Okay, so we'll begin the discussion on this one. Um, we'll forego the statistics because that those were covered during the online class. So for the interest of time, we'll skip the statistics. Okay. Okay. All right. So I think we can go through this one. Okay, so I think we stop at this point. So, what was seen in the statistics, aside from the numbers, is that men are more permissive when it comes to casual premarital sex, meaning to say, ito yung mga tinatawag natin na hook up in general. However, based on the statistics as well, the women are also doing that, or are also engaging in that particular practice. And then, okay, so in terms of the elements of, okay, and then in the elements of satisfaction, women are seen to, they want to seek more of the demonstrations of love and intimacy, while men are more focused on arousal or sexual gratification. In terms of several domains, like for acceptability of homosexuality and acceptability of masturbation, information in the US shows that there's no difference between the gender. And in terms of the importance of sexual satisfaction, it's also the same. Men and women have, they put a premium on sexual satisfaction. So, syempre, 'di ba? Why engage in that activity if you're not going to um enjoy it, no? So, anyway, next. Okay, so we have what we call the sexual self schema, which pertains to the beliefs about own sexuality. So this is our idea of how we are attractive, or how attractive we are sexually, so on and so forth. And as stated in the previous slide, women are more likely to value the experience of passionate and romantic feelings. And then, despite of the day and age, what they have seen is that there is still a minority of women who have embarrassed or conservative or self-conscious views towards sex. So, um, so minority na lang naman siya in the US. I'm not sure here in the Philippines if it's still the same, given that we are lagging behind in terms of sex education. Our sex education curriculum as well as system is very poor. And then another information about sex in terms of gender differences is that males have fewer negative core beliefs about sex and more likely to emphasize dominance and aggression. So this is why with some porn, parang the dominant theme, or the domineering theme, is the one that males usually like to watch. Um, then pag tinignan yung statistics sa mga porn site, makikita nyo ano ba yung mas kinikater niya. So, that would be a good thing to see. At least yun yung alam natin na statistics here in the Philippines, no? Hindi katulad nung mga ibang statistics na nasabi ko. I don't think we can access or we have readily available data on those particular matters. Okay, next. Okay. Now, in terms of the summary of sexual differences, the men shows more sexual desire and arousal, and then their self-concept includes power and independence. So, which is still holds true up until this age and time. Whereas with women, they emphasize more on the context of a committed relationship. So, this is why a lot of women would not like, 'di ba, yung ano, parang third party, of course, 'di ba? Kasi nga they are seen to hold premium on a commitment. And then, aside from that, sexual beliefs are more easily shaped by cultural, situational, and social factors, and that is for women. So, this is why mas hindi gano'n ka-progressive pa ang sexual behavior ng mga babae because a lot of their sexual schema sa self-concept revolves or are shaped by these factors. Unlike with men, especially men who were raised in a patriarchal society. Okay, next. Okay. Wait lang. Okay. Now, in terms of the sexuality in children, so there are society that already has these views in children. Like for example, in Zambia, people from Papua New Guinea, they believe that receiving semen contributes to the development in children. So, um, so it doesn't really have an emphasis on uh so they emphasize rather on homosexual oral sex between teenage and young boys, but it's not something that they frown upon on. So it's a cultural thing. Okay, and then in Munda, India, they emphasize on mild heterosexual activity like mutual masturbation among cohabiting children. So again, this is not something that is um, punished in them kasi nga, again, it's acceptable in their culture. And then in terms of the permissiveness towards casual sex, it tends to vary from culture to culture. So like for example, with the Western culture, it's they are quite permissive in terms of casual sex. So, um, I if I remember correctly, that's one of the early struggles of my friend who migrated to Singapore. So, ang dami yan dinidate na expat din, mostly mga Caucasian. Um, And then sabi niya iba siya sa mga Pilipino in terms of how they want the relationship to progress. So yun nga daw yung kung yung mga Pilipino daw pa ikot-ikot pa, ayan daw mga straightforward, and then parang they don't hold it against you if you have sex with them first after first date. So may mga ganong differences, and it's because that's the way in their culture. So yun lang, kung hindi ganun yung culture mo, you have to find a way, if especially if you're dating people from the Western culture and ganun yung dating scene nila. There's no you have to find a way to compromise with them. Okay. Okay, next. Okay, so the development of sexual orientation is something that had been discussed in your developmental psychology. So I hope you had remembered that, because this is very essential in understanding this particular discussion. So um, actually, if you read carefully that discussion or lecture or that particular topic, sexuality is fluid, meaning to say, um, walang tao na forever na straight, walang tao na forever na homosexual. At some point in time, there might be changes in the sexual orientation. So it that would of course vary um based on this. So depending on the interaction of the biopsychosocial influences as well. So um example of this one, homosexuality, only a small genetic component, about 50% of identical twins raised together do not share the same sexual orientation. So, dun nga pumapasok si biopsychosocial influences. So, katulad nga nito, identical twins na same yung genes and same environment, but then, in terms of their sexual orientation, they identified to have different sexual orientation. Like, for example, si Raymond at saka si Richard ba yun, if I'm not mistaken, yung mga kapatid ni Rufa Gutierrez. So, the two of them are identical twins. However, one is happily married with a son, and I'm not, kasal na ba sila nung, sino ba yung nanay no anak niya? Anyway, basta yon, with a partner, and then his brother, who identified as gay, is also in a relationship with another man naman. So makikita natin na hindi porket parehas yung environment, hindi parehas, yeah, parehas yung environment, parehas yung genes per se, or the genetic structure, given that they are identical twins, it doesn't mean that they would have the same sexual orientation as well. So, ang laking portion nito, halos kalahati ng identical twins yung sinasabi niya. Okay, next. With sexual dysfunctions, eto na tayo sa sexual dysfunctions. Kaya siya tinawag na dysfunction, it's because there's a problem in the sexual functioning of the person. So, usually it involves the desire, arousal, or orgasm of the person. And then, sometimes there is pain associated with sex that can lead to the dysfunction. Now, to be able to say that it's a sexual dysfunction, the presence of the problem should be for at least 6 months or more in order to make a proper diagnosis. And then it leads to an impairment in order to be considered as a problem. So, anong impairment or distress yun? So, syempre, parang nagiging hesitant na siyang makipag-sex kasi nga it's painful for the person, or yun, nababawasan na siya ng interest for having sex because of the problem that the person is encountering when engaging in sexual activities. Okay, so this is the context of sexual dysfunction as according doon sa sexual phases. So, yan. Desire phase, wherein you would feel the sexual urge or arousal, like for example, when you're watching porn. So, desire phase na yon, yung naramdaman mo na yung libido mo. And then, arousal stage wherein that is the subjective sense of sexual pleasure. So, subjective siya in the sense of, um, are you feeling, yeah, the pleasure or gratification while doing the foreplay, those things. Ano pa ba? Kasi may mga iba na parang ano eh, pinifake to, especially sa mga babae, that no type of foreplay can seem to turn them on. Yan. Okay, so ito yung mga physical changes nila. So like for example, for the men, of course, the blood rushes to the penis, kaya tumitigas yung penis nila, 'di ba? When they get aroused. With females naman, they get vaginal lubrication, so they get wet, or and or to yung iba naman, ayun, nagkakaroon ng erect nipples kasi nga um as a physical signal that they are already aroused. Then, ayan, plateau phase, wherein the brief period occurs before the orgasm. So, ayan yung plateau phase. Orgasm phase, in males, feelings of inevitably the ejaculation. So, tapos, ayan, mag-ejaculate na sila. Females, contractions of the wall and the lower third area of the vagina. And then, in the resolution phase, there is the decrease of arousal after orgasm, particularly in men. So, bakit siya nakalagay particularly in men? This is because with women, hindi ganon kabilis bumaba yung ano nila, yung arousal nila. Mahirap silang i-arouse, pero pagdating dito, hindi ganon kabilis bababa yung high nila. Unlike with men na mabilis ma-arouse, but then, pagdating sila mag-ejaculate, ayun, pababa na ulit yung arousal nila. So, babalik sila ulit doon. So, this is why with women, di ba, may sinasabi silang mga concept na multiple orgasm. This is because of that physiological difference. And then, for men, after this, ayan, desire phase ulit sila. So, they can engage again in having sex. So, this is the normal sexual phases. Okay? Now, pagdating sa sexual dysfunctions, may part dyan na parang anomalous or ano bang tawag natin dito? Yung medyo nahihinder. So, depende yan kung anong type ng dysfunction. Okay, next. So, the prevalence of the sexual dysfunction is that actually it's extremely common, and for some people it's not that distressing kasi nga sa sobrang common niya, parang naisip mo na even the person beside you might have some sort of sexual dysfunction in another form. So, in one study, they find out that about 40% of men had some difficulty with erection or ejaculation, and about 63% of women had problems with arousal or orgasm. So ang taas ng number kung makikita mo. And then, with males and females, they experience the parallel versions of most dysfunctions. So, despite of the differences in their physiological makeup or physiological structure, there are parallel versions ng dysfunction nila. So, alamin natin yun maya-maya. Okay. Now, the classification naman of sexual dysfunction. So, aside from what I told you in the online class or in the synchronous class, we also have to consider this. Ito yung, ano ba to? At yung mga kailangan mong malaman din in this particular group of disorder. Hindi siya katulad nung ibang disorders na tackle natin so far na chronic, yeah, chronic ang pinag-uusapan, uh, severe, 'di ba? Severity, level of severity, kung mild ba siya, moderate ba siya, or severe yung condition, or kung meron siyang specifier. So, sa kanya, ang specifier niya are the following. So, first off, if it is if the condition is lifelong or if it is acquired. Okay, so if lifelong, kahit iba-iba yung sexual partner niya, na nangyayari pa rin sa kanya yung dysfunction. On the other hand, si acquired, there are specific situations or people that causes the dysfunction to happen. So, a good example of that one yung may mga ano kasi may mga cases na nare-rape ng asawa nila mismo. So, ayun, acquired yun. So, parang may ganun ako nabasa na case na tinitigasan siya sa ibang babae pero sa asawa niya hindi na, kasi there was one point na the guy felt violated because the wife forced him to have sex. 'Di ba? It's a bit uncommon to hear that the wife would rape the husband, but that was the case as according to that particular report. So I forgot kung saan ko na nabasa yon, and that was bakit ko nga ba binasa yon? I think it was a reference to one of the reports or cases that I was doing. So, kaya ko hinanap yung report na yon. Anyway, so going back to this one. And then we also have this one, generalized versus situational. So, ayun, in general ba yung condition niya, or is it based on a specific situation? And then, is it caused by psychological factors alone, like for example, stress ba siya or may depression siya or anxiety, and that causes the sexual dysfunction, 'di ba? Kaya nga, again, you have to study the factors, the different relationship factors that can affect the sexual relation of the person. And then psychological factors combined with medical conditions. So, like for example, if the person suffers from depression due to an existing condition like ano ba to? Like cancer. Nalaman niya may cancer siya. So, na-depress siya, diba? So, that can also affect the sexual functioning of a person. So, the first disorder that we are going to be discussing, but this is just an overview, lahat yan overview. You can read it further in your DSM-5 TR para mas makita nyo siya. Okay, so, the male hypoactive sexual desire disorder. So, this is a disorder wherein the man does not show or have no interest at all in any type of sexual activity. If they do engage in masturbation or sexual fantasies, and even the act of sex itself, these are more or less rare. Minsan lang siya mangyari sa case na to or sa tao na to. And then, so about 5% of males report having this type of condition. And then next one. Okay, so next one is the most common one, or one of the mostly heard conditions for males, and this is erectile disorder. Now, erectile disorder, this is difficulty in achieving or maintaining an erection. So, unlike the okay, I'm sorry for those noises. I'm not sure kung every weekend ba or every day may ano kami dito. May racetrack ba dito sa ano namin sa sa street. Anyway, going back. So, with this particular case, compared with the previous one, they have sexual desire intact. So, naa-arouse pa rin sila. But the problem is that the arousal is not manifesting physiologically, 'di ba? Remember yung sexual phases kanina, 'di ba pag nagkaroon na ng arousal yung isang tao, nagkakaroon na ng physiological changes. So for males, there should be an erection already kasi doon siya uh, yun yung isisignal ni brain sa body natin or sa body natin, sa lalaki nga lang pala to, sa body nila na okay, punta doon lahat ng blood kasi may sexual behavior or sexual response na mangyayari. So, yun ang usual or normal reaction ng katawan when it enters the arousal phase. However, for them, they have already entered the arousal phase, but they are having problems with being erect or maintaining the erection. Kasi either titigas siya pero saglit lang siya titigas. Hindi matagal yung pagkakaroon niya ng erection to the point na ayun, baka hindi pa magkaroon ng penetration or vaginal penetration when it would come to the sexual act na talaga per se. And this particular condition is one of the most common type of problem that men would seek help for. And as seen by the statistics, tumataas ang prevalence nito when the guy ages. So, about 60% of men over 60 experience erectile dysfunction. And this has something to do, of course, with their physiological changes na. Kasi nga, tumatanda na sila. However, if they are on the younger side, like for example, 20s, 30s, medyo may problema if they are having this problem when they are still very young. Okay, next. So, this one is the female sexual arousal disorder. So, this is the counterpart of the this one. Yan, male hypoactive sexual desire disorder. So, this is why you have to be very careful with the name kasi nga, counterpart siya. Okay. Now, for females naman, of course, different ang manifestation nito kesa sa lalaki. Sa kanila kasi, they lack or they would show significantly reduced sexual interest or arousal. And they would usually show it through the following. First off is reduced sexual interest. So, any sexual advances nung sexual partner nila, they would not reciprocate or even when seeing like for example sexually arousal materials like porn, they would not really look into that, or they would not really be very interested with that. And with that, of course, sexual activity is reduced, both the sexual act itself and sometimes even masturbation is reduced. Then they would also have fewer sexual thoughts. Ayan, reduce arousal to sexual cues. So, sometimes kahit may mga nakahubad ng nasa harapan nila, they don't really respond to that. And lastly, reduce pleasure or sensation during almost all sexual encounters. So, ayan. So, this is why it's very important that you know the term for the specific gender kasi magkaiba yung manifestation. Although similar siya in the context per se, but the manifestation of the disorder differs in the gender. Okay, next. The next one is female orgasmic disorder. So this one is a marked delay or absence or decreased intensity of orgasm in almost all of sexual uh, encounters. So ito naman, hindi siya nakakaabot ng climax or hindi siya nakapag-orgasm. So, actually the problem with this one is that they don't really understand why it's happening. They cannot pinpoint if it's a problem with the relationship itself, or if the client or the female is going through other stressors that causes the hindrance of orgasm. And then what the statistics show us is that about 1 in 4 women have significant difficulty achieving orgasm. However, there are other papers or there are other studies that claim na it might be due to how long, or in terms of foreplay, 'di ba? In terms of the foreplay, siguro hindi masyadong mahaba yung foreplay para sa mga clients na may ganito, to the extent na ma-arouse nga sila and cause them to easily get to their orgasm. Kasi may mga ganong proposal. Ang nakita kasi nila sa study is that there are some who have or who can easily achieve orgasm because the foreplay is longer. There are some who are also seen to easily achieve orgasm because they have or they engage in a masturbatory activity. So may ganong proposal kasi nga baka daw yun yung nagko-cause dahil this two cannot explain why this is happening or experienced by the client. Okay. Next. So the next one is premature ejaculation, wherein the ejaculation occurs within -1 minute of penetration and before it is desired by the person or by the guy himself. So, this is the most prevalent sexual dysfunction in adult males, aside from the erectile dysfunction. But that one is more common with the or that one is highly correlated with age. Um, but this one, it affects about 21% of all adult males, and this is most common in younger and inexperienced males. So, nakikita nila na mas mataas ang um, ang prevalence nitong condition na to sa mga guys na parang wala pa masyadong sexual experience. And then with that being said, the statistics have also shown that the problem tends to decline with age. All right. Now, on the other hand, we have the genitopelvic pain or penetration disorder. This is, ano bang tawag namin dito sa DSM-4TR? But, vaginismus or vaginismus. Okay, so, pala kayo kung paano i-pronounce. Pero yun yung tawag dito before. It's already a combination of two condition from the DSM-4TR. Kasi meron pa kaming tinatawag na pain disorder. Yun naman yung talagang hindi naglubricate naman yung vagina niya that will allow easier penetration. Tapos yung vaginismus, ayun yung sobrang tense naman ang vaginal walls that it doesn't allow penetration. So, may difference yung dalawang yon. Pero with DSM-5, they decided to make it into just one. Okay. Now, with females, it's difficulty with vaginal penetration during the intercourse, and it is associated with one or more of the following. So first up is the pain during intercourse or penetration attempts. Then, coupled with the fear or anxiety about pain during the sexual activity, and then there is also the tensing of the pelvic muscle, floor muscle, in anticipation of the sexual activity. So, meaning to say, wala pa yung penetration part, pero nagte-tense na yung pelvic floor. So, pagdating nga nung itatry na, i-attempt na i-penetrate, hindi siya nag-a-allow ng penetration to the point na yun, masakit talaga yung pagpasok. Okay. So, when we assess sexual behaviors, ayan, an interview is a must. And this is very important. The clinician must demonstrate comfort with the topic. So, this is what I've been telling you in the synchronous class. Kasi you really have to dig deep in uh, their sex life. I've been doing that since I was ano bang edad? Since right after I left college. So, 21 years old pa nakapagka-graduate ko. That was my question lagi. Kasi nga annulment cases. So, hindi pwedeng hindi namin tanungin ang tungkol sa sex life ng mga kliyente namin. So, ayan. At dahil gawa nga ng nature ng trabaho ko, so I had to ask what are their sexual attitudes, what are their sexual behavior, so yung mga yan, sexual response cycle. So I've heard a lot of things that a fresh college grad na virgin shouldn't really hear. Pero you also, this is where I had to learn how to keep a poker face on. Kasi, hindi pwedeng hindi pwedeng nagtatanong ka ng mga gantong question tas pulang-pula yung mukha mo. Because, the client will also feel that you're uncomfortable asking the questions. So, dahil makikita niya yung discomfort mo, hindi na rin siya magiging comfortable in answering your questions candidly, which is going to be a problem for you later on, or the psychologist later on, since sila yung magda-diagnose nung case. Okay. Yeah, relationship issues. So you also have to ask that in terms of if they had talk about their boundaries when it comes to sex. Kasi nga, there were a lot of times na hindi agree yung isang party doon sa gustong mangyari ng other party when it comes to sex. So, marami akong narinig na ganun. Merong mga sakto lang naman yung demand. Meron yung mga over the top yung demand na if you're not really open-minded, or if you're not really someone who's liberated, it's going to be very uncomfortable for you to hear those things. So, and then this one, of course, the physical health. If the partner has both, or the couple had problems with their health that might cause an issue with how they have sex. And then, of course, the psychological disorders itself. Kasi baka naman may existing condition si client or mismo yung partner, and then the client wants to have sex, but then the condition of the other party is hindering them to engage in a fully satisfying sexual activity. So, may mga ganun kang dapat i-consider as well. And then, in the assessment part of, or the sexual behavior part of the assessment, we also have to see the medical side, a medical evaluation per se, like for example, their medication, what are the side effects of the medication. So, um, I had a client like that recently. So, ang sabi niya, parang, isa sa mga naging concern niya was that she was having, problems being interested with having sex with her partner. So sabi ko, why? Is it because of the emotions involved, blah blah blah? Sabi niya, no, it's not really like that. I still love my partner, pero sabi niya, wala talaga. Parang hindi daw siya um, uh, to use her term, hindi daw siya nalilibugan. And then it turns out that she was drinking a medication for her PCOS. Um, Meron kasi mga ganon na kasi like for example, with women after they have their period, pag nag-ovulate sila, tumataas yung sexual drive nila, and this is for the uh, procreation purposes. So, ano yun, physiologically nangyayari talaga siya. But in her case, since tinatry nga i-regulate yung menstruation niya para maging regular siya, parang isa yun sa mga naging side effect nung ginagamit niya. The same with, ito naman hindi ko naman client, pero parang friend ko, gumagamit naman siya ng birth control pills, and the pills is from a different country, hindi siya ano dito, yung manufactured dito, parang galing sa ibang bansa when she was still working in that country. And then yun yan, na nasabi niya sa akin na parang sa pilitan na daw siya makipag-sex sa partner niya. And sabi ko, baka naman it has something to do with your medication, so you have to look into it kasi um, baka kasi yun yung ano. Kasi I asked naman, yun nga, ito binalikan namin, wala naman siyang problema dito sa mga to. Parang nawalan lang talaga siya ng interest. And then when I try to see um, condition wise, okay naman daw siya, healthy siya. Ang pinag-iinom niya ay vitamins, aside from yun nga, yung prescription niya para naman sa birth control. So sabi ko, tingnan mo, baka yun yung may side effects na ganun. Kasi if you're drinking supplements and vitamins, I don't think it's the one that's causing your disinterest in having sex with your partner. And then of course the physical condition themselves. So if the person has a physical condition that's limiting them to have sex, that might be the cause of the problem, or that might be the factor that affects their sexual behavior. And then we also have the psychophysiological assessment. Now with this one, you really have to have a laboratory in order to see what happens to them. So like for example, ito, measure mo yung sexual arousal in response to an erotic material. So with males, bibigyan mo ng ano, ng pornographic material. So ayan, para makita mo yung uh, kung mag-e-erect ba yung penis niya or hindi. So uh, may specific tool that would measure that. And then same with females, they have what we call the vaginal photoplethysmograph. Okay, and then this one measures the blood flow to the vagina naman. Okay, next. In terms of the causes of the dysfunction, of course, we have to look at it in the biopsychosocial model. So let's see first the biological. So biological, again, as I have been mentioning kanina pa, or since we started discussion on this, there might be a physical illness that the person is suffering from, and this causes the problem. So like for example, if the person is diabetic, diabetes actually lowers the libido, and then there are side effects of their medication as well, the insulin, and this might cause the problem. Like for example, yung erectile disorder or erectile dysfunction, and then like the mood, uh, parang masyadong magagalitin. So definitely it will not help with setting the mood of having sex with your partner. And then chronic illnesses, like for example, meron siyang heart ailment, and the person is not really allowed to they are not really allowed to uh what do you call this, engage in strenuous activity. So yun, that might be one factor. Another is ayan, prescription medication. So that might be also causing the problem with the person, in terms of how they um, respond sexually. And then, of course, alcohol and drugs. So, contrary to the belief that the alcohol will stimulate the sexual dysfunction, alcohols are downers in reality. So, hindi yan stimulant. So, paano yan makapag-stimulate ng sexual response or behavior if all of your system are parang going down or parang papatulog na siya. So, yes, pinapalakas niya yung loob mo in the sense na you can make up a story that you forgot what happened, so on and so forth. But this is a downer. Hindi yan nakapagpataas ng libido. So, I'm not sure with drugs, but with alcohol, yes. Kasi yung drugs, meron tayong stimulant na drugs, meron tayong downer na drugs. Okay. In terms of psychological, people with sexual dysfunction are more likely to experience anxiety and negative thoughts about sexual encounters. So, yan. When people are aware that they have a sexual problem or yan, sexual dysfunction, like yung mga nagkakaroon ng premature ejaculation, na-anxious yan, or they would have a negative sexual schema about themselves. Kasi nga, the one or two encounter na hindi maganda or hindi nila na-achieve yung pleasure both for them and their partner will impact their self image and self concept a lot. Okay, and then with that being said, they might actively avoid awareness of sexual cues. So yan, katulad ito, men with erectile dysfunction that tend to distract themselves purposely to avoid orgasm. Sorry, not, yeah, tama. Kala ko napindot ko na. Tama pala. Pinipindot ko. Okay. So, let's break it down more specifically. So, let's see what is the effect of anxiety on sexual arousal. So, previously believed to decrease arousal and contribute to sexual dysfunction. Kasi nga, when you're anxious, you're on the edge. Remember, na pag-aralan na natin what happens to the body when we are constantly anxious, 'di ba? So, parang nagfa-fight or flight mode siya. And when we are in this particular state, medyo mahirap magkaroon or i-process yung sexual phase when we are in this state. Okay. However, there are some cases like anxiety, like getting an electric shock in the laboratory, increases arousal in response to an erotic material. So, there are some studies like that wherein alam nila na i-electrify sila, so pero nakita nila nag-spike up yung arousal response nung tao na yon, while they are thinking about being shocked and watching pornographic material or erotic material. So, ayan. Distraction often increases arousal and awareness of own sexual response. Kasi nga, when we are distracted, we tend to focus on other things, not really much on the things that we are stressing about, the problems that we have. And with that being said, ayan, mataas ang chances na pwede niyang i-increase yung arousal natin. And of course, how we, the consciousness that we have in terms of how we respond sexually. Next. Okay. So let's see the functional versus dysfunctional sexual arousal loop. So for functional individual, ayan, ito yung loop nila. So let's say explicit or implicit demands of for sexual performance like a responsive partner or other contexts leading to public expectation or performance. So meron silang for functional, meron silang positive affect and expectancies, accurate reporting of arousal, perception of control, and then they also have attentional focus on erotic cues. With that, they have increased autonomic arousal and increasingly efficient attentional focus on erotic cues. And then, of course, when that happens, nagkakaroon ng functional performance, meaning to say they are able to perform sexually nang walang problema. Whereas with the dysfunctional, this is their negative feedback loop. So, same din ng stimulus. So, negative affect. Kaso, pagdating pa lang sa first part, negative affect kagad ang nangyayari. So, yung expectancies inaccurate and underreporting of arousal, perceived lack of control. So, yan. Kasi nga, again, they are underreporting. Yan, hindi nila nire-report. Yun din kasi isa sa mga problema. Ang problema with some of the clients with this condition, especially with male, they would not really report accurately ano yung nangyayari, especially if they suffer from erectile dysfunction or premature ejaculation. Kasi nga para sa kanila nakakahiya. Kasi hindi ako tinitigasan or yung isa, kasi nilalabasan ako kagad. So, definitely, parang they would tone down the severity of their case dahil nga they feel that they might be judged by the clinician if they report it accurately, forgetting the fact that the clinician is there to help them out with their condition. And then the next one, in terms of attentional focus on public consequences of not performing or other non-erotic issues. So, dito sila nakafocus na parang, hala, baka hindi na ako balikan nito or baka din na siya makapag-date sa akin or blah 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 or what not. Whereas with dito kasi, nakafocus lang siya dun sa ginagawa niya sexually. Eto, habang nakipag-sex, iba yung tumatakbo sa isip niya. So, definitely, especially for those who have problems with the arousal, yung male hypoactive condition, hindi talaga siya maa-arouse kasi nga ang attention niya ay on other things rather than focusing on the sex itself. Although, parehas din sila may increased autonomic arousal, it's more on being aroused because of the anxiety of what they are feeling and thinking about these things of non-performing. And then, increasingly efficient attentional focus on the consequences of not performing. So, yan, dito na talaga sila nakafocus na hala, hindi ako tinigasan ng ganun kahaba or sabihin nung sa babae naman, baka hindi na to makipag-date sa akin kasi hindi talaga nakapag-penetrate, etc., etc. Alam ko may ganong palabas, Japanese na movie yun. I forgot the title. Napanood ko siya kasi a story niya is that um, they were school sweethearts. I'm not sure kung high school. And then they decided to marry. However, nung nagpakasal na sila, parang they were boyfriend and girlfriend first. Tapos nung inattempt nilang mag-sex for the first time, um, hindi nagkasya yung lalaki. So, akala nila parang pares lang silang kinakabahan kaya hindi nag-penetrate or hindi sila nag-engage talaga in sex. So, sabi na, let's give it a try another time. So, trinay ulit nila, hindi pa rin. And then, finally, nagpakasal na sila. However, nung kasal na sila, ayun, nakaka-feel pa rin ng discomfort yung babae. So, wala pa ring penetration na nangyayari. So, basically, they are not having sex in the real sense of the word. Until such time na parang nagkaroon na ng problem sa relationship nila kasi nga walang sex na nagaganap. And then the woman decided to look for other sexual partners kasi nga parang hindi ma-fulfill nung asawa niya or may problema sila in terms of the build per se. Kaya she looked for other sexual partners, pero surprisingly she was not feeling pain and when it comes to other uh, men. So, walang problema. Um, Doon lang talaga sa asawa niya. Kaya, ayun, parang nagkaroon din sila ng problem in that sense. Kasi, eventually, nahuli siya ng asawa niya na may ibang lalaki. Tapos, parang alam ko, nag-divorce ba sila o nag-separate lang. I forgot the title, pero maganda naman siya. Maganda naman. Happy ending naman siya. Don't worry about it. So, ayun nga. Bakit ko brinot up yung movie na yun? Kasi nga, ang attention niya is focus on the consequences of not performing. Kasi more on nakafocus yung movie dun sa babae kaysa sa guy. And then, of course, it leads to the dysfunctional performance and the avoidance of sex. So that's the difference between the functional people and the dysfunctional people when it comes to sexual arousal. Okay. Now, on the other hand, for the sociocultural cause of sexual dysfunction, we have what we call the erotophobia. Now, erotophobia, this is it is associated with sexuality with negative feelings, anxiety, or threat. So, ayan, they don't really feel that sex is going to be a pleasurable activity for them. I had a coworker like that before. Um, she doesn't she doesn't really look at sex positively. Niloloko ko nga siya dati kasi sabi ko, ano ba yan? Dahil ba yan sa mga storya ng mga kliyente natin for annulment cases? Sabi niya, hindi, basta takot lang talaga ako about sex. So, when we talk about it, nung one time na nag-inuman kami, sabi niya kasi nga, parang, unang-una, she was not given a sex talk, and then her experience so far with her past boyfriend was that ayun parang pinipilit siyang makipag-sex pero ayaw niya talaga. So I think that is where the negative feelings is coming from. And then the anxiety kasi she had several friends then na outside of our work na ang kwento naman sa kanya is masakit daw pag first time. So, yun, nagkaroon din siya ng anxiety because of those kwento. So, sabi ko, sabi ko sa kanya, bakit ka maniniwala sa kanila? Unang-una, experience nila yon. Pangalawa, their partner, hopefully, will not be your partner naman. So, why have this kind of anxiety? So, fortunately for her naman, she's already married and she's living in Japan, no? Sana all. So, Next one, ayan. Unpleasant or traumatic sexual experiences. So, of course, especially for those who had been victims of rape. So, may mga gantong factors kaya nagkakaroon sila ng sexual dysfunction kasi nga because of these things. Pwede ring poor interpersonal relationship. The person does not know how to communicate. The person does not know how to approach other people. So that would lead to even avoidance or not really actively seeking sexual relations. Yan. And of course, lack of communication. The person does not know how to communicate what he or she needs in terms of sex. Okay, now in the treatment of sexual dysfunction, one of the treatment, of course, is education. So, as according to the studies, education actually is one of the most effective way to help with the treatment of sexual dysfunction. So, actually, ito nga yung isa sa mga ina-advocate ng mga psychologists na we have to revamp the sex ed para mas maging effective siya and then makover not only the things that should be covered, yung mga STD, hindi lang yun. Kasi doon nagfo-focus not so much on this type of conditions na dapat din i-focus. Kasi these are also very important to know as well, especially for students na nasa age ng curiosity. So, Masters and Johnson's study had led to the development of psychosocial intervention. So, one of the things that they discuss in this particular intervention is education about sexual response and foreplay. So again, this is a very good way to do that, to dispel any myths about that, and also for both partners, especially kung uh, females and also with males, 'di ba? They would understand the importance of this, the sexual response and the importance of foreplay. Para makita nila na it's not just gratification per se, and it's not just something to be curious about, but it's something that is scientific, and also it has kumbaga, you will have a big consequences if something comes out of that particular activity, or if you engage in sex without protection. Okay. They have this is also seen sensate focus, or focus on the sensation, and non-demand pleasuring, wherein kasi I remember with males, dun sa statistics, they are more on the dominant and aggressive side when it comes to sex. Kasi there are attitudes kasi na sa males na parang ano bang tawag namin doon? Wham bam, thank you ma'am. Yung walang consideration sa pleasure ng partner, especially if the partner is a woman. Remember doon sa pinag-usapan natin kanina, medyo matagal ang arousal ng babae kaysa sa lalaki. So, with that being said, importante ang foreplay sa mga babae. So the men really should know how to do, how to engage, or how to help their partner to achieve arousal or sufficient arousal para makapag-orgasm din or ma-achieve din ng orgasm for females. Okay, now, but in this particular intervention, ayan, especially for those who are or who have premature ejaculation, and a parallel version of that for females, ayan, sexual activity with the goal of focusing on sensations without trying to achieve orgasm. So this one is especially helpful for those with premature ejaculation. And what they have found out with this type of approach is that it decreases performance anxiety. Kasi nga, uh, they would teach the client or the person to focus on what they are feeling instead, or the sensations that they are feeling related to the sexual behavior, instead of focusing on the anxiety related part uh, of the sexual behavior. Okay, next. So another way to address that is the psychosocial procedures. Um, Psychosocial procedures, they have what they call the squeeze technique. So this is for the premature ejaculation. Then masturbatory training. This is for those female orgasm disorder. Use of dilators for those with vaginismus, yung genitopelvic pain disorder, and exposure to erotic materials for those with low sexual desire problems. So, these are all under the psychosocial procedures. Okay, next. Okay, so we also have the medical procedure or medical treatment for people with this type of disorder. So for erectile dysfunction, of course, we have the Viagra. This had been in the market since I was in elementary ata or high school. Parang pinag-aaralan na nila to even during that time. However, there are side effects uh, of the medication, just like any medication, of course, and headache is one of them. So ang sinasabi nang naman nila, if you would have headaches, you can discontinue if this is felt. And then there are those who would have injection of vasodilating drugs to the penis, directly to the penis. I'm not really sure what it does per se, or ano siya, or anong laman niya to per se. You can look it up. And then eto kasi yung iba, pinapataas yung dosage ng testosterone nila para masustain yung erection. Kasi for some, ito yung problema, mababa yung testosterone level nila. Or those who doesn't really have a way, or parang hindi effective itong mga to. Others would go through this one, penile prosthesis or implants. So, naglalagay sila ng implants sa penis itself. Others would have vascular surgery, and then yung iba naman vacuum device therapy. Okay. For women, the problem is that there are very few medical procedures for female sexual dysfunction. However, for the medication or the drugs, Levitra, yun yung pinaka-common na ginagamit. Okay. Okay, so if you have any questions on sexual dysfunctions, please take note of that. We'll try and answer it in our other meetings next week. Okay, so moving on to the paraphilic disorders. Now, the paraphilic disorders, these are kayasha disorders. These are misplaced sexual attraction and arousal. So, it can either be focused on inappropriate people or objects, so people such as younger than the person themselves, or ano ba yun? Or those who have like a mental disability, so that is also inappropriate people, because the maturity for these people, like yung may mental or intellectual disability, the maturity is of course not as not as comparable as those who doesn't have intellectual disability. Now with objects naman, ayan, it can be yung mga fetishes, like they get aroused with underwear, panties, yung mga ganon, lingerie, shoes or feet, 'di ba? Nandoon yung sexual arousal nila or attraction nila, and not on the person themselves. Okay. Often, there are multiple paraphilic patterns of arousal. These are common. Pero, it doesn't connote na if there are paraphilic arousals, like, for example, you get turned on with the underwear that they are using or they are wearing. It doesn't mean that you have paraphilic disorder per se. It just so happens na parang nakadagdag yun sa sexual arousal mo or attraction mo dun sa tao na nagsuot nun. And then with paraphilic disorders, they are seen to have high comorbidity with anxiety, mood, and substance use disorder. Okay. Now, the paraphilias in the DSM-5 TR, so ito na yung list ng disorders na. We have the fetishistic disorders. Ito nga yung may mga fetishes. The most common is the foot fetish. So there's a lot of literature about that. This is something that's quite uncommon or unnatural, because we know what our feet are for. What feet are for, right? So it's for walking, running. So it's basically for our stability. So, but this is why it's quite unusual to see people who would be ano ba to? Who would be very attracted to feet, kasi nga iba nga ang function talaga ng feet natin. So that would be under the fetishistic disorder. So there's a lot of other fetishes, but the foot fetish is one of the most common. And then we have next the voyeuristic disorder. So ito yung naninilip. And then hindi na siya basta naninilip, but the person gets sexually aroused with the action of peeking or peeping at someone. So may ganun siyang factor, kasi iba yung naninilip lang or nasilip ka lang doon sa they are doing that for sexual gratification. And then we also have the exhibitionistic disorder. Ito yung nagpapakita naman. Hindi siya naninilip, nagpapakita naman siya. Usually it's male, very uncommon siya sa female. Or kung meron mang female, mas mababa yung number niya kaysa sa lalaki. And we have a lot of this. Even here in the Philippines, may encounter kang ganito. Sa jeep, habang naglalakad ka sa street. My sister and I encountered one when we were on our way home from the market. So, pinakita ni Kuya yung penis niya sa amin. And then, fortunately, my sister and I were both aware, or parang, they get their satisfaction when the woman would panic, would be scandalized dun sa pinapakita nila. So kami ng sister ko parang nagkatingin na lang kami, and then sabi namin, ay, yan lang yun, ang late naman, and then dire-diretso kami sa lakad. And then nung after namin, siguro mga 2 blocks ng layo namin sa kanya, before turning to each other and commenting further, we made sure na wala na yung guy. And then it turns out that my sister was quite shocked. So sabi ko, tama lang yung pinakita natin kanina, kasi if we would show more reaction than that, the person will have their gratification. So yung pinakita natin na reaction, that is a blow to the ego, and that that didn't motivate further reaction from him. So, maganda yung ganong ano. So, girls, ganon yung gagawin nyo. Pag may ganong instances na nangyari. There was also, para doon naman pala sa isa. Ito susunod, futuristic disorder. So, ito naman yung kinikis-kis niya yung sarili niya. So, any part of the person, I have not seen a person, yung kinikis-kis niya talaga yung harapan niya doon sa, and again, this is more on males than females in terms of the statistics. Pero sa jeep, I had seen one like this when I was, I think, in college, and I was in college na ba? Yeah, I was in college and I was on my way somewhere. And then may nakasakay akong high school na babae. Malaking bulas siya. So, meron siyang ano, alam mo yung parang laging nag-zone out. The man beside her, very very disgusting kasi the guy is already married and had a kid. The kid is beside him. His kid is beside him while he was doing the action. Kinikis-kis niya yung siko niya doon sa side boobs nung high school girl. So, um, ato naman si Ateng, hindi ko malaman kung hindi niya maramdaman dahil sa padding ng bra niya or kasi malaki talaga yung boobs niya eh. For someone her age, malaki. Malaking bulas siya. And then, or ano, parang ay natatakot siya. So, as soon as the seat beside me was vacated, I asked her to switch. Pumunta siya dito sa side ko. Sabi kong gano'n. Sabi ko, ate, dito ka. Sabi kong gano'n. Tapos, ang sama ng tingin ko dun sa guy niya. Kasi, all throughout the ride, parang more than 5, 10 minutes, gano'n ang ginagawa niya. Hindi siya yung, ano, kasi 'di ba may times sa jeep, lalo na pag siksikan or marami yung nakasakay sa jeep, na babangga talaga, lalo na sa babae, yung side part. So, yung side boobs mo, mababangga siya. Pero sa kanya, very intentional. Dinidikit niya talaga yung siko niya doon sa boobs nung high school girl. Which is very disgusting. Kasi, he was beside, or his son was beside him all throughout the ride while he was doing that. So, ganun katindi si kuya. So, and then after that, ayun, tumigil siya, lalo na nung na tunugan niya na alam ko yung ginagawa niya. And he was doing it on purpose. And then we also have this one, transvestic disorder. This one is more on putting on clothes of the opposite sex, but not because they identify as that sex, but they like the more or less, these are limited most of the time sa lingerie. Gusto nila yung mga underwear ng mga babae. So they like the feel for that. Again, this is more prevalent with males than females. So they enjoy putting on the clothes, particularly lingerie, of females because the arousal increases when they do that. Then we also have the sexual sadism and sexual masochism disorder. Now, this one, we have to put in the term sexual, kasi nga, sometimes kasi we use the term sadist for someone who enjoys inflicting pain on others but not for sexual gratification. So, this is why kailangan ilagay natin tong mga words na to sa unahan as an adjective for us to understand that this is really something that belongs to paraphilic disorder. And then we have this one, sadistic rape. wherein if you would look back with some of the cases during the martial law, there are a lot of sadistic rape that happened during that time. Uh, may isang ano I forgot kung sino siya, pero isa siya sa mga prominent figures during the martial law. And she was not shy in relating what happened to her during the martial law. She was raped, and before she was raped, parang may mga incidents na parang ayun tinutuluan daw ng nung ano yung kandila, yung ano niya, yung vagina niya. So you can just imagine the pain that was inflicted to her before she was raped. So basically she was uh, not treated as a person while that act was being done on her. So this is why we don't like martial law or anyone related to uh, the implementation of martial law. Okay, and lastly, we have the pedophilic disorder and incest. Now, the pedophilic disorder, ito nga yung, ano ba to? You would have a child or someone who's not sexually mature yet in terms of physical, emotional, and psychological. Yung mga yon ang pinag-uusapan natin. Hindi porket consenting siya, it's okay um, to show your sexual advances kasi we're still talking about development and maturity here. Hindi pa yan mature to make those types of decision. So kasama na din dito yung mga ginugroom, like for example, I forgot that media that it's ano, it's a very disturbing uh, teen magazine, teen manga, teen girl manga, shouju, not soju, shouju manga. I forgot the title. Pero yun kasi ginawa sa kanya. Pretty much the protagonist there is a child, and when she was left by her mom because her mom succumbed to illness, yung parang may lalaking tumulong sa kanya, but the guy groomed her to be his wife, and then pero bata pa siya, so that is already that can be labeled as pedophilia. And then of course incest, wherein you would engage in sexual actions and behaviors to people na kamag-anak mo. So um, to what degree of affinity, it varies from culture to culture. Here in the Philippines, I think up until third degree is considered incestuous. Um, pero hindi ko sure kung if it still holds. Pero of course, ang pinaka illegal is having a sexual relations with one's uh, own siblings, brother, sister, father, or mother. So, yun ang incest. Okay. So, in terms of understanding paraphilia or paraphilic disorders, these are its clinical descriptions and causes. So, usually it is manifested in fantasies, urges, arousals, or the behaviors mismo na pinapakita. And as I've told you last time, paraphilia is not always disordered. So, meaning to say, it's not always considered a disorder. So, like for example, yung may mga fetishes, hindi siya always na porket may fetish ka, automatic may disorder ka na. It's not the case. Sometimes it needs to fulfill yung criteria na may distress na nangyayari dun sa tao while having that kind of sexual behavior or sexual response. So, yan. It is only considered when it is only considered disorder when the individual experiences clinically significant distress or impairment. So, like for example, for those with fetishes, foot fetish, mako-consider lang siya na impairment like hindi talaga siya ma-arouse unless very attractive sa kanya yung paanong partner niya. That is an impairment. That is a distressing situation, 'di ba? Okay naman yung okay naman yung partner niya, okay naman in terms of physical attractiveness or whatnot. Pero pagdating sa paa, hindi niya type yung paa. Let's say, for example, sobrang laki ng paa nung partner niya for his own liking. Let's say, kasi dahil, let's say, engaging in heterosexual relations. So, babae yung partner niya. Tapos nakita niya yung paa ng partner niya for someone who's just 5 foot 1 inches or 1 inch tall. Ang paa ng partner niya is 9. So, ang laki ng paa ng partner niya. So, pero, physical wise, in terms of maganda yung partner niya. Pero nakita niya yung paa, ay, hindi pleasing sa akin yung paa, ayoko na. Or hindi siya magkakaroon ng arousal. So, that can be a problem. So, that can cause an impairment in the relationship. And of course, if the condition or they act on the urges that they have with a non-consenting person. So like for example, yung mga exhibitionistic, almost always they are considered as a disorder. Kasi nga, yung pinagpapakitaan nila, these are people who did not consent to see their body, na parang, sige, pakita mo sa akin yung ano mo, papakita ko rin yung ano ko, 'di ba? Walang ganoon na pangyayari. They just like the thrill of it, kaya nila pinapakita. Okay. Next. Okay, so ito nga yung kanina, patterns of seeking sexual gratification from rubbing up against unwilling others often occurs in a crowd or in confining situation from which the other person cannot escape. So like for example, a crowded elevator or subway. So ayan. Kaya this is why I don't like MRT kasi there were too many situations like that before. And this is also why parang gumawa na ng sariling bagon ang MRT for exclusive for girls because of complaints about these types of behavior. Okay. So next one is but going back to this one, I think that is dito nga natin nakikita na medyo mali yung yung sex education natin. There's something wrong with our sex education that needs to be fixing. Kasi katulad nito, the problem with this disorder is that to be able to avoid this from happening to women, they decided to put an exclusive car or cart for women only para hindi na sila kiskisan ng mga taong makakasakay nila in the MRT. 'Di ba? Parang bakit ganun yung solution? Parang I hope you're getting where I'm getting. Kasi like for example for me, I don't want the hassle kasi lalo na pag nagmamadali ako. 'Di ba parang nasa dulo yung bago ng babae. Paano kung kakababa ko pa lang ng ng escalator. So more or less doon ako sasampad doon sa pinakamalapit sa akin, or otherwise may iwanan ako ng tren. So I think it should be more focused, or they also have to capitalize on the proper sex education or teach people manners. Alam mo yun, yung personal space, the concept of personal space, so that we can avoid these things from happening. Ang hirap pa naman itong hulihin here in the Philippines. In other countries, ang bilis niya, talagang may magre-respond sa'yo. Here in the Philippines, parang ikaw pa yung mahihiyang magreklamo. So, hopefully in the next few years, mag-improve na yung gantong ano natin, sitwasyon, no? Okay. Next one, ayan, fetishistic disorder, sexual attraction to non-human objects. So, it can be inanimate or tactile. So, an example, ayan, it can include rubber, hair, feet, objects such as shoes. So, merong mga iba yun, they like the feel of the rubber on their body. So, nagpapagawa sila ng rubber suit. And then they feel aroused when they are wearing that. So when they are just doing that for their own fun or gratification, that may not be a problem, or that may be considered not a disorder. However, if it's causing disruption in the relationship, like for example, yung partner niya doesn't really like the smell of rubber and doesn't really find it arousing, so that that's the time that the assessment might change to a disorder. Okay. Then, voyeuristic and exhibitionistic disorder. Ayan, voyeurism, observing an unsuspecting individual undressing naked or engaged in sexual activity. So, the risk associated with peeping intensifies sexual arousal. Ayan, so, the thrill of getting caught na naninilip excites them more, aside from the things that they are seeing. And then exhibitionism, ayan, exposure of the genitals to unsuspecting strangers. The element of thrill and risk is necessary for their sexual arousal. Kaya nga, again, you have to react in such a manner na hindi ka na bother doon sa pinakita nila, kasi the more you react, the more it's thrilling for them. So, ganun yun. Kaya, mas maganda na you react in a bland manner or in an unbothered manner. Okay. Next is... Wait lang. Bakit hindi nagano? Okay, so yan. Transvestic disorder, yan nga, sexual arousal with the act of cross-dressing. Males may rarely show high masculine compensatory behavior. Most do not show compensatory behavior. Now, for US, this is based on US statistics again. Many people with assessed with this disorder are married, and this behavior is known to their spouse. And this is not inherently pathological and only considered to be disorder only considered as a disorder when it causes distress or impairment na. Okay, but most of the time, or the cases that I've read, hindi siya problem. If I'm not mistaken, may gantong palabas movie. I forgot the movie title na naman. Diyos ko po, ano ba nangyayari sa akin? Pero ang artista ay yung bida sa Fantastic Beasts and Where to Find Them. His name is at the tip of my tongue. My God. Eddie? Eddie, I forgot his last name, but Eddie, the guy, It started out parang nag-cross-dress lang siya because he wanted to help his wife with her painting, but then later on ayun doon na nagkaroon ng problema kasi he got so into the cross-dressing and began to engage in homosexual relationship. So doon na nagkaroon ng problema after that. Okay. Okay, so sadism, sexual sadism, and sexual masochism disorders. With sadism, this is understood as inflicting pain or humiliation to attain sexual gratification, and then sexual masochism, this is the opposite. The person enjoys suffering pain or humiliation to attain sexual gratification. Now, question about this. Are the two often partnered with each other? So, kailangan na, kunwari, sadist ako, kailangan ng partner ko ay masochista. Okay, think about it. Read thoroughly para masagot nyo yung tanong na to. Okay, next. Yan. So, sadistic rape, some rapists are sadists but most are not. So, that is according to the statistics and information that we know about rape cases. So, fortunately, or not fortunately, but the rape itself is already hard to accept. Pero the statistics show that most rapists did not show paraphilic patterns of arousal. So, meaning to say, hindi naman lahat ng rapists are sadists. Yun nga lang, may mga cases nga na yun, there are rapists who tend to show sexual arousal to violent and non-sexual material. So, like for example, the rapist saw you crying, ganon, they get aroused with that. It's not yeah, parang kaya nga sila parang sadistic rape na kasi they enjoy their victim being humiliated. So yon, kaya parang na-enjoy nila yon more like or most of the time. And then there are cases, may napanood akong documentary sa Netflix. I think he falls under this category, sadistic rape. Parang the raincoat killer, if I'm not mistaken, the raincoat killer ba yun? This case happened in South Korea. Nire-rape niya yung mga mga bar girls. And then before he raped them, after he raped them, he will kill them. And then may mga instances na habang pinapatay niya or china-chop up niya, ayun, nagkakaroon siya ng arousal doon sa ginagawa niya. And then I think there was even a time na parang patay na, ni-rape niya pa ulit yung yung bangkay na. So, I think he would fall under this category if I remember the case correctly. Okay, now going to the pedophilic disorder. So, pedophilia, yan, sexual attraction to prepubescent children. Actually, yung term nga na ginamit, prepubescent, ibig sabihin, children going through puberty. But there are cases na mas younger pa sa or hindi pa nakaka-reach ng puberty stage, may attraction na sila. And most of the people who have pedophilic disorder are males. So, for females naman, it's quite rare but not unheard of na talagang walang ganon sa mga babae. Merong ganyan sa babae pero hindi ganon kadami, unlike with males. So, in some cases, pedophilic urges are limited to incest, like the young members of one's own family. So, many people who have it do not act on desire, and they would rather engage in compensatory moral behavior, or meaning to say behavior that's quite accepting and would not act on their sexual attraction with to children. Okay. Now, associated features, incestuous males may be aroused by adult women. Male pedophiles are usually not aroused with adult or by adult women. So some they try to rationalize their behavior. I've been watching yung mga reactions ni Cinnamon Toast Ken sa To Catch a Predator. That is again at a US TV show wherein they do entrapment operation on pedophilic or males with history of pedophilia. Some of them may case na before. Some of them parang bago pa lang ine-explore yung na yon. And ang 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 undercover nila doon na agent, kasi parang malalaki naman yung mga babae ay mga bata sa America, right? So ang pinapain nila doon na na uh, parang yun nga yung preteen or teenager na babae is one of their undercover agents na mukhang bata. So yun yung ginagawa nila. So doon makikita niyo ang dami doon. And then, ayun, whenever they are caught on act, they would rationalize na, kasi mag-ano lang kami, mag-hangout lang kami, ganto, 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 ganto. Pero, pag kinalkal yung mga bag or tiningnan yung pockets nila, tatanungin ng police, bakit ka may condom kung mag-hangout ka lang with a teenager? Or, bakit ka may lubricant? Or, bakit ka may sex toy sa bag mo kung hangout lang na walang anything sexual yung gagawin mo. So, may mga ganon. So, causes of paraphilic disorder, isa sa mga nakikita nilang dahilan is difficulty in forming a normal relationship. Like, for example, they have deficits in typical sexual experiences. So, yan, parang medyo mahirap sa kanila yung engaging in ano ba to? Yun, yung mga phases na parang, like for example, yung crush, yung mga ganun. Siguro may mga rejections na nangyari. So, hindi talaga nagkaroon ng yung parang progression in formulating or establishing how is it to be in a normal relationship. And then relationship difficulties in childhood or adolescence, it might be the ones that they witness within the family themselves, like for example dun sa parents nila, or yun nga yung experience nila with their peers. May rejection sa peer, rejection dun sa mga crushes nila, so may mga pwedeng ganong experiences. Early experiences may lead to sexual associations by chance, then reinforced through masturbation. So, those who engage, medyo mataas yung, nakita naman natin kanina sa mga, ano ba to? Sa graphs kanina, that they have actually pretty high number in terms of teenagers engaging in sexual behaviors. So that those experiences might lead to sexual association by chance even as they grow older, and then they would reinforce it through masturbatory activities or behavior. And then people who have this type of disorder are seen to have a very high sex drive, and what they have seen, or what the clinicians have seen, is that suppressing might not be helpful kasi nga it can increase the urge more. The more that you suppress it, the more that it increases. Okay. So, we're not going through this anymore. Mahaba na naman yung discussion. Okay, so what are the psychosocial interventions for these disorders? First up, they would like to target the deviant and inappropriate sexual association, like for example, the ones with pedophilia or pedophilic disorder. So, yun ang deviant. Kasi nga, the target, you're targeting someone who's younger than you, someone who's not physically, emotionally, and psychologically as well as sexually mature. So, yun ang ita-target mo. And what's the inappropriate sexual association na nilalagay doon nung isang tao. And then, next is covert sensitization, like imagining aversive consequences to form a negative association with the deviant behavior. So, like for example, pedophilia, so sasabihin nila, imaginein mo yung yung they would ask the person with pedophilic disorder to imagine someone that's not attractive to them while having this type of uh, arousal response. Para nga para matamp down kasi nga it's all about association inside the brain. And then orgasmic reconditioning, masturbation to appropriate adult stimuli. So they might be likely be put on a lot of exposure to pornographic material na appropriate sa age nila. And of course, yung kumbaga acceptable yung mga sexual behavior and responses. Okay. In terms of the efficacy, okay, the efficacy is mixed. The poorest outcome, meaning to say, yung hindi masyado nag-improve are the ones who are rapists and those people with multiple paraphilic disorders. So, like for example, meron na siyang exhibitionistic disorder, meron pa siyang pedophilic disorder. So, yung mga ganong cases, yung mga problematic at okay, so ayan, going back with my discussion, sorry, I want to have a water break. Poorest outcome or low efficacy is those who have rape cases and those with multiple paraphilic disorders. And incarcerated offenders are actually difficult to treat. So parang ano rin yan, parang mga may substance abuse disorder, yung mga in layman's term addict. So medyo ang hirap din yan i-treat kasi nga they are already addicted to what they are doing. So hence the course is chronic and they have high relapse rate. However, in terms of treatment, what they have found out is that outpatient treatment is more successful than when you put it in an in-house rehabilitation center. Now, for drug treatment or medications, they have the cyproterone acetate, and this is basically what they call the chemical castration kasi binababa niya yung desire, the sexual desire and fantasy. However, after the drug had been cleansed out of their system, ayan, bumabalik ulit sila sa ganong ginagawa nila. And then they also use the Depo-Provera, which reduces the testosterone in the clients who have paraphilic disorder, the male ones, of course. And yan. Most useful for dangerous sexual offenders. So some take drugs to avoid going to prison kasi nga mas in US actually mas mabigat ang penalty nila for sexual offense kesa sa ibang type ng crime. And then kailangan reported ka pa nun. Let's say for example, you're going to another state and you have a sex offense in, let's say for example, Makati. You have a sexual offense case in Makati. Before you go to Mandaluyong, you have to report to um, parang probation office ng Mandaluyong and state bakit ka nasa Mandaluyong. Kahit na kunwari, ang work mo is Makati to Mandaluyong, 'di ba? Kahit nag-work ka lang doon, kailangan alam nila kung asan ka. Kasi nga, you're going to be listed as a dangerous sex offender. Okay. Okay, now moving on to gender dysphoria. Now, gender dysphoria, this is seen as, or this was changed. The name of the disorder before was gender identity disorder. So it was renamed because a lot of the members of APA are who are also members of the LGBT community. They are parang they were offended with the term na it was a disorder per se, but even in the previous DSM editions, it was considered as a disorder. Yun talaga yung name niya. Parang sa mga earlier pa nga, parang homosexuality nakalagay, if I'm not mistaken. So ito, they put dysphoria kasi it's the gender, or the incongruence of the gender expression and the gender that they are experiencing or feeling that they should have are not matching. So they are not pretty much, they don't feel that they are happy or satisfied with what is going on with them. So the clinical overview is as follows. They have this feeling of being trapped in the body of the wrong sex, and they often assuming the identity of the desired sex. So causes are actually unclear, but as according to science, gender identity usually begins between the 18 to 36 months of age. So parang 1.5 year, and then ilan yung 36? Sorry kasi hindi nga tayo pinagbibilang. Up to 3 years old, 'di ba? So up to 3 years old, that's the time that we are exploring our identity na. So fluid or cross-gender identity is not a disorder unless it causes a significant distress or impairment. So again, it's not a problem if it doesn't really affect the specific areas of your functioning, as we have mentioned in other types of conditions as well. So I had this client before, yung tumawag when I was still doing online consultation. Tawag siya, kasi nga ang daming misconception about gender dysphoria. It's not hindi po siya hindi sinabing pag gender dysphoria parang equivalent siya na you're gay, you're lesbian, so therefore you have a disorder. No, the problem here is that you feel that you feel that you are in the body of the wrong sex, and then you would assume the desired sex. So kasi may mga gays and lesbians tayo na they are okay with their body. It's not really something that parang wala silang problema dun sa katawan nila per se. So they just express themselves in a more masculine or feminine manner, but they don't have a problem with their build, how they were born. But ito kasi, may problem talaga sila. They feel that they are trapped in that body kasi nga hindi yun dapat yung body nila, because they are identifying the sexual identity of the desired sex that they have or that they feel. So this is actually relatively rare. So um, despite of the connotation to other people, this is actually rare if the clinician would really follow the criteria for this disorder. However, this is more common with males, but kung titingnan nyo, yung incidence niya is 5 to 14 per thousand. So, medyo mababa yung number niya, kaya nga rare ang sabi sa kanya, versus to the 2 to 3 per thousand in females. So, that is the case for the this disorder. Okay, next. Next is okay. So rates in culture. The rates are actually similar across culture. Some cultures revere individuals with non-traditional gender experience, like for example, biological male adopting a female role seen as a shaman, so on and so forth. Okay, now with the causes, there is no clear biological cause identified yet, but what they see is that it might have a genetic component, since they have found out that about 62 to 70% of variance in gender expression is explained by genetics. So, mataas na percentage yun. Also, exposure to certain hormones in the womb, like for example, the mother have higher levels of testosterone, it might masculinize a female fetus, and vice versa pag mas mataas yung estrogen. So, ayun. Okay, so in terms of treatment, so ito na yung sex reassignment surgery. So ito na yung iba, kaya nga iba yung term na gender reassignment sa sex reassignment, kasi ang sex reassignment, we are talking about the ayan, yung going through surgery para maging congruent na yung kanilang body doon sa nafe-feel nilang gender nila, na dapat yun yung gender nila. So like for example, Charisse Pempenko, however, before she got, I'm really sorry kasi nga, since I'm I'm relating the case to her original self, so I'm using the pronoun for female. I'm sorry if someone gets offended, pero kasi that's how that's how I see it. Okay, so um kasi nga I'm using her original identity. Okay. So, before she went through that, meron pa yung mga katakot-takot na counseling in order to make sure that she was able to understand the consequences, and also ano ba yung mga changes na mangyayari physically, emotionally, mentally, so on and so forth with those things. Aside from that, the social factor are also discussed with them, kasi kailangan nilang mag-reintegrate sa society, not as their original gender, but as their desired gender. So, from male to female, kailangan nilang assimilate ulit. Kasi nga, remember, iba ang may mga gender roles pa rin tayo na pinufulfill, kahit sabihin natin progressive na at this times, at this day and age, there are still gender roles that we need to fulfill, as this is part of our purpose in the society, and then the society expects us to do these things. So syempre, iba yung turo sa'yo when you were female, and now that you're male, magkakaroon ng ibang expectations, kasi nga you said that you're male. So, ito ngayon, ano sa'yo, papaliwanag sa'yo, ito yung mga expectations sa males, so on and so forth. So, what they have seen is that about 75% report satisfaction with their new identity. And what they have seen so far is there is a high um, female to male conversion. Mas nakakapag-adjust better than their counterpart. So, treatment of intersexuality, so they are often treated with surgery at birth. Subsequent gender dysphoria may uh, need to be addressed. So, there are those na parang, ayan, may mga intersex kasi na mga tao na hindi fully na develop kung ano yung sexual organ nila. So, parang nagiging in between. So, sometimes ina-address yun right after the birth, inaayos yun ng doktor. Yun nga lang with them, dahil nga inayos siya, the physiological was addressed right after the birth, even before the person trying to explore their identity, sexual identity, 'di ba nga, which occurs around 18 to 36 months old. There might be a problem later on with gender dysphoria. And then, treatment of gender nonconformity in children. So, gender nonconformity is common and may not lead to gender dysphoria. So, in US, ginagawa na nila yan. They are teaching children, like for example, colors is not gender, colors are gender neutral. Like for example, 'di ba? Society lang naman ang assign ng na ang pink babae, ang blue lalaki. So, in some places in the western, they do that. And I think they started first with the jobs. So, ganun nila tinuturo na yun sa mga bata, especially yung mga nasa kindergarten, daycare. So, para makita that the equality is really happening. So, this is quite a good practice. And para rin kasi mas ma-express nung tao or nung bata later on, ano bang gender yung feel niya sa kanya. However, gender nonconformity can lead to negative social experiences kasi nga, if you are a nonconforming person na tipong biologically you're female and yet parang ayaw mag-anak, ayaw mong di ba? So that's gender nonconformity. Parang yung nangyayari ngayon, di ba? Ang daming nagsasabi, especially for millennials na nasa latter years na. So kasama na ako doon. Parang, ba't di ka mag-anak? Hindi ka babae unless may anak ka, blah, blah, blah. So, yung mga ganon. That is quite problematic because later on kasi there are some decisions in your life na pag iisipin mo, parang, yeah, okay na mag-anak, pero kaya ko bang mag-anak or gusto ko bang mag-anak? And sino bang piniplease ko dito? So, ayan, if hindi ka magko-conform nga doon sa gender role mo, it can lead to a lot of negative response, especially from the society. Okay, there might be some conflict between affirming the child's identity and encouraging cisgender behavior to improve adjustment. So, ito ang isang problema lang doon since you are trying to you're trying to help boost the child's ego or confidence or self-esteem by affirming their identity. However, it might be counterproductive if the identity is hindered with the encouragement of the cisgender behavior, para lang makapag-assimilate siya sa society. Does that make sense? Yeah, I think it makes sense. So, yun kasi, like for example, the child is male. So, and then gusto niya ng halos pang babae na sa tingin ng society pang babae na mga things like for example Barbie dolls or dolls, makeup. So there are parents who encourage that kasi nga there are nowadays there are more and more males who are into um, uh, hairdressing and also as makeup artists but they are straight, 'di ba? However, 'yun, magkakaroon kasi ng conflict doon pag ipapasok mo na yung ano ba yung expected behavior for a male child in the society. So definitely a lot of people will frown on the child if they see the child playing with Barbie doll and makeup kit. So yun. So pwedeng alisin yun ng parents kasi nga para mas maging accepted siya sa society or mas mag-assimilate siya sa society na ginagalawan niya. Okay. So with that being said, nakita nila the importance of individualized treatment in order to respond to the child's specific needs and the environment of the child themselves. Okay. Now, this is the last slide. Mahaba-haba talaga yung discussion, sorry. So, sexual dysfunctions are very common. Sorry for the typographical error here. So, it can be either problems with desire, arousal, and or orgasm. So, when I have clients like this is one of the things that I usually tell them na ayon, common siya kasi nga ang daming nahihiya when they try and mention it. So, ayun, kina-clarify ko sa kanila yung bagay na to para mag-open up sila. Ayun, kasi nga um, pag hindi kasi nila pag hindi kasi talaga nila yan na pag-usapan, it might be they will be shortchanged. And then with the paraphilic disorder, again, it is these are the group of disorder that are representative of inappropriate sexual attraction. There are for the two of these disorders there are psychosocial and medical treatment options and often are seen efficacious or effective. However, ayan, comprehensive assessment and treatment approaches are the best. Kasi kahit na gaano ka effective ang medications and psychosocial treatment, if you're not going or if the client is not going to help the practitioner to help them understand ano bang nangyayari, definitely hindi naman maibibigay itong mga treatment option na to kasi nga hindi maintindihan ano bang nangyayari sa kanila. And then, for gender identity disorder or gender dysphoria, basically this is the feeling of being trapped in the body of the opposite sex. Kaya those people who are gays or lesbians or who identify as a different gender identity, it wouldn't be a problem or it wouldn't be a disorder unless they have this feeling. Yan. Hindi siya gender dysphoria unless you felt trapped in your own body and it causes problems. Okay, so that's it for this very long discussion. Kahit pinutol na natin siya, mahaba pa rin. And I'll see you all for the next discussion. Please prepare for your post test. Bye, guys.